Dr. Harris, would you like to say a few minutes?
Thank you.
Can you spell your first name for us?
Dr. David W. Harris. I am a practicing endocrinologist from Tulsa, Oklahoma. I'm the president of the Tulsa County Medical Society for this year. When speaking about this issue, I like to, first of all, think of what's most important. And what's most important to myself, as well as my colleagues here, is patient care. And in fact, the most important individual out of us here you've not heard from yet, and that's going to be our patient representative. When I think about the SGR, Sustainable Growth Rate Formula, I've been in practice now for over 20 years, and this is something that happens on an annual basis. I refer to the SGR as being, I would use the analogy of a carrot on a stick this year, because we have had more than 3 to approximately 4 fixes thus far, and this is still on the slate of congressmen to address. So I would urge those individuals that would care, first of all, about taking care of patients, and especially for green country, of which I represent, and for the state of Oklahoma, for patients in Oklahoma, to get behind this campaign and let the ink flow. Let's provide 1 million signatures to Congress to see that we get a permanent fix for SGR. I will speak more about SGR in that perhaps the name should be changed to SRR, Sustainable Reduction Rate, because that's what physicians have endured over the last several years. And I think the most important thing is I can only reiterate what has been said previously, in that when I speak with my constituents in Tulsa County, and when I speak with my constituents in green country, northeast Oklahoma, there's definitely going to be, and we're already seeing, a problem with access to medical care for patients that have Medicare, Medicaid, and also, most importantly, TRICARE. And I think that the individuals that serve our country in the military and that are with TRICARE deserve the utmost and best care. They deserve the best access to medical care. Being the product of a military family myself, I have a special interest in seeing that those individuals get taken care of. So I can only urge those that would have the opportunity to sign and provide those 1 million signatures to do so. Thank you for your time.
Thank you, Dr. Harris. We have a patient here. He doesn't have any prepared remarks, but if you'd like to ask some questions of any of us, we'd sure be delighted to answer any questions. You want to come up and...
All right. I'm a Medicare patient. Hearing this hasn't made me feel any more comfortable. Quality care starts with access. We are in the middle of a political process, and I would call on my peer group to get involved, and this is a constructive way to do it. And I'd be happy to answer any questions.
What's your name, sir?
My name's Bill Davis.
How do you spell that?
Billdavis.
And where are you from?
I'm from here in Oklahoma City. I have spent 40 years in the healthcare field as an administrator. I am the administrator of a group here in Oklahoma City.
Has your health care been diminished or in any way affected because of what the doctors are complaining about, the low reimbursement rates?
My concern is about the future. At this point, we've not experienced what's coming our way, and I think that's the reason it's time to act.
For those of us not familiar with the SGR, can you go over that again and what Congress is supposed to do by when?
Yeah, and I'll refer you to the last page in your handout there. The Sustainable Growth Rate was created as a formula for reimbursing physicians under Medicare, I think about 10 years ago. And that has remained static in terms of not adjusting for a cost of living. If you look at those bar graphs there, you can see that hospitals and nursing homes and even Medicare Advantage have done fairly well in terms of getting their rates adjusted, while physicians have pretty much remained static for almost the last 10 years in terms of the reimbursement.
What is your name?
My name's Ken King, and I'm the Executive Director of the Oklahoma State Medical Association.
So your concern is that if June 1st, if Congress doesn't act, reimbursement rate is going to drop 20%, and you will be able to pay your bills.
Well, I think
Doctors will
that-
be able to, that's the basic line, they will be able to make as much money, obviously, and they will lose their
Right.
practice. Is that what you're saying?
I think that's a big concern, is how do we keep the doors open? As in any business, you know, if you're facing a 21.5% cut in your payment, it makes it very difficult to keep your practice viable. And I think that's a big concern out there, is how do we keep these physician patients and patients in a relationship if it's not economically viable for them to keep their practices going?
Is it 21% or 21.5%?
Well, it's 21.5% is the number that we've heard from the AMA.
I know you're talking about cuts, but what explains the increase in practice costs? What about this other line?
Well, a lot of it is just general cost of living increases is a substantial portion of that increase. The other is that there's more patients, and there's more patients being seen, and it's those are really reflective of the cost of increasing practice in Oklahoma.
So